Fetal hiccups are one of those fascinating and sometimes puzzling experiences during pregnancy. If you're pregnant or know someone who is, you might have heard about them or even felt them yourself. But what exactly are fetal hiccups? Are they normal? Should you be concerned? In this video, we'll cover everything you need to know about fetal hiccups, from what causes them to how they feel, and even what you can do to stop them if they seem to be happening a lot. So, without any further ado, let's get started. What are fetal hiccups? Fetal hiccups are exactly what they sound like, hiccups that occur in a developing baby while still in the womb. Just like adults, babies can experience hiccups, and these tiny spasms are a normal part of fetal development. These hiccups are caused by the sudden contraction of the diaphragm, which is the muscle that separates the chest from the abdomen and plays a key role in breathing. When the diaphragm contracts involuntarily, it causes the vocal cords to close quickly, resulting in that familiar hic sound. In the womb, of course, you won't hear the sound, but you can feel a gentle, regular jumping or twitching sensation in your belly. Think of them as little practice sessions for your baby's breathing muscles. These hiccups are completely different from your baby's normal kicks and movements. While kicks can happen randomly and feel like rolling or pushing, hiccups have a steady, rhythmic pattern that usually lasts for several minutes. When do they start? Fetal hiccups can start as early as the first trimester, though you won't feel them this early. Your baby might begin hiccuping around 6 weeks into pregnancy, but most pregnant people start feeling these movements between weeks 20 and 24. Some might notice them even earlier, especially if this isn't their first pregnancy. Frequency and patterns. The frequency of fetal hiccups can vary greatly from baby to baby and even from day to day. Some babies might hiccup several times a day, while others might only hiccup occasionally. These episodes typically last anywhere from 3 to 15 minutes, and they often happen at similar times each day. As your pregnancy progresses, you might notice changes in how often your baby hiccups. They're usually most noticeable during the third trimester, though some women report feeling them less frequently as they get closer to their due date. Causes of fetal hiccups. The exact cause of fetal hiccups isn't fully understood, but there are a few theories that explain why they might happen. One of the main theories is that hiccups are related to the baby's practice of breathing movements in preparation for life outside the womb. These movements help the diaphragm and respiratory muscles strengthen and prepare for the first breaths after birth. Another normal trigger is swallowing. Babies in the womb swallow amniotic fluid constantly, which helps their digestive system mature. Sometimes swallowing too much fluid or swallowing it quickly can irritate the diaphragm, leading to hiccups. This is similar to how adults might hiccup after eating too fast or drinking something fizzy. In some cases, fetal hiccups may be triggered by stimulation of the vagus nerve, which plays a role in controlling the diaphragm. Swallowing amniotic fluid, sucking on a thumb, or other natural fetal activities can stimulate this nerve and cause hiccups. While fetal hiccups are almost always benign, there are rare cases where they could hint at an underlying issue. One potential concern is umbilical cord compression. The umbilical cord is your baby's lifeline, supplying oxygen and nutrients. If it gets pinched or wrapped around the baby's neck, a condition called a nuchal cord, it can temporarily reduce oxygen flow. Some studies suggest that babies might hiccup more frequently in response to this stress, almost like a reflex to try to improve oxygen intake. However, this is usually accompanied by other red flags, like a sudden drop in fetal movement or changes in the baby's heart rate during monitoring. Another rare possibility is fetal distress due to hypoxia or low oxygen levels. In very unusual cases, prolonged or extremely frequent hiccups, especially later in pregnancy, might be a subtle sign that the baby isn't getting enough oxygen. This could be linked to placental issues, maternal health conditions like preeclampsia, or problems with the amniotic fluid levels. Again, hiccups alone aren't enough to diagnose this. They'd likely be paired with decreased movement, an abnormal heart rate pattern, or other symptoms. How they feel. When you feel fetal hiccups, you'll notice a rhythmic bumping or pulsing sensation. Unlike kicks, which can come from different directions and with varying intensity, hiccups have a regular pattern and usually happen in the same spot. Many women describe them as feeling like a gentle, repetitive tapping from inside their belly. The sensation might be stronger depending on your baby's position and how far along you are in your pregnancy. Some women describe it as feeling similar to a gentle muscle twitch or like popcorn popping in a very steady rhythm. Are fetal hiccups normal? In most cases, yes, fetal hiccups are completely normal and are actually a good sign of your baby's development. They indicate that your baby's nervous system is maturing and that their reflexes are developing properly. However, like many aspects of pregnancy, the amount and frequency of hiccups can vary significantly from one pregnancy to another. When to monitor the hiccups? While fetal hiccups are typically nothing to worry about, there are some patterns you might want to pay attention to. If you notice that your baby is hiccuping very frequently, more than 4 times per day, after 28 weeks of pregnancy, it's worth mentioning to your healthcare provider. This is usually nothing concerning, but it's good information for your provider to have. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of fetal hiccups. Fetal hiccups don't typically require any specific diagnosis as they're a normal part of pregnancy. However, your doctor might assess them during routine prenatal visits. Here's what they might do. During ultrasound examinations, hiccups might be visible as regular rhythmic movements. Your doctor can confirm that what you're feeling is indeed hiccups and not some other type of fetal movement. They might ask you to keep a kick count chart, which can include noting episodes of hiccups. This helps track your baby's overall movement patterns and activity levels. If you're concerned about the frequency of hiccups, your provider might use electronic fetal monitoring to observe your baby's movements and heart rate patterns. Treatment for fetal hiccups. In most cases, fetal hiccups do not require any treatment, as they are a normal and healthy part of pregnancy. However, if the hiccups are causing discomfort or concern, there are a few things you can try to help ease them. Number 1. Change your position. Sometimes simply changing your position can help reduce fetal hiccups. If you've been sitting or lying in one position for a while, try standing up, walking around, or shifting to a different posture. This can encourage the baby to move into a new position, which may help stop the hiccups. For example, if you've been lying on your back, try rolling onto your side or sitting up. Movement can also help stimulate the baby and encourage them to settle down. Number 2. Eat a small snack. Eating a small snack can sometimes help calm fetal hiccups. Choose something light and easy to digest, like a piece of fruit, a handful of nuts, or a cracker. The act of eating can stimulate your digestive system, which may in turn help regulate the baby's movements. Avoid heavy or spicy meals, as these can sometimes make hiccups worse. If you're not sure what to eat, try something bland like a banana or a slice of toast. Number 3. Stay hydrated. Dehydration can sometimes contribute to increased fetal movements, including hiccups. Make sure you're drinking plenty of water throughout the day, as staying hydrated can help regulate amniotic fluid levels and reduce the likelihood of hiccups. Aim for at least 8 glasses of water a day, and consider carrying a water bottle with you to remind yourself to drink regularly. If you're unsure whether you're drinking enough, check the color of your urine. It should be light yellow or clear. Number 4. Practice relaxation techniques. Stress and anxiety can sometimes affect fetal movements, so practicing relaxation techniques may help reduce hiccups. Deep breathing, meditation, or gentle prenatal yoga can help you relax and create a calming environment for your baby. Try taking a few minutes each day to sit quietly, close your eyes, and focus on your breath. You can also try progressive muscle relaxation, where you tense and then release each muscle group in your body, starting from your toes and working your way up. Number 5. Monitor the frequency. While occasional hiccups are normal, frequent or prolonged hiccups may warrant further attention. Keep track of how often your baby hiccups and how long each episode lasts. If you notice a significant increase in frequency or duration, or if the hiccups are accompanied by other unusual symptoms, such as decreased movement or pain, contact your healthcare provider. They may want to perform additional tests to ensure everything is okay. At the end, fetal hiccups are usually nothing to worry about, but there are a few situations where you should seek medical attention. If you notice a sudden decrease in your baby's movements, or if the hiccups are accompanied by other concerning symptoms, such as pain, bleeding, or fluid leakage, contact your healthcare provider right away. These could be signs of a more serious issue, such as umbilical cord compression or fetal distress. Now, we want to hear from you. Have you ever felt your baby's hiccups during pregnancy? How did they feel, and what did you think they meant at the time? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.